Before you start breastfeeding, take your baby naked on your breasts right after birth and spend some alone time with him. This is the first contact you will experience and is very important. Sit comfortably in a calm and noiseless environment. Physical relaxation also relieves milk release. Hold your baby with his whole body facing towards you, but don't let your arms stop him from reaching your breast. Before you start breastfeeding, make sure your baby's nose is open, if not, clean it. To start breastfeeding, do not push your baby's head towards your breast or force your nipple to begin. This can irritate him and cause him to refuse to suck. Take a drop of milk from your nipple and touch your baby's cheek. You stimulate the search reflex, finds the nipple itself. Before you start breastfeeding, hold the upper part of your chest ring with the thumb and index finger of your free hand and the lower part with your other 3 fingers and press it lightly. It facilitates the flow of milk into the channels and prevents your baby's nose from being buried. In milk secretion, there are 2 reflexes, milk production reflex and milking reflex. The milk production reflex prolactin helps you to sleep better and rest quickly. The milking reflex, on the other hand, accelerates the recovery of the uterus after birth. Both are affected by your emotions, thoughts, anxiety and perceptions. Touching your baby, being with him and hearing his voice will support the normal functioning of these reflexes. In negative situations, these reflexes are suppressed and prevent your milk flow. Lactation. As soon as your baby shows that he is ready to suck, breastfeed him. If the first hour of breastfeeding is spent, your baby will be unwilling for a long time and your first breastfeeding may be delayed. Leave your breastfeeding period entirely to your baby's will and breastfeed immediately, day or night, whenever it wants. The more your baby sucks on one breast, the more milk your other breasts and grows. If a breast stops breastfeeding, that breast stops producing milk. So, every time you breastfeed, feed both your breasts. The breast size is not related to the milk glands but the amount of adipose tissue. Regardless of your breast size, you can produce enough milk. Don't worry and motivate yourself in a positive way. When your breastfeeding is over, do not force your breast out of your baby's mouth, may damage the nipple. Cut the suction pressure by slowly inserting your little finger into the side of the mouth and pull out your breast. Breastfeeding doesn't hurt, not supposed to hurt. If you do feel pain, your baby probably has misplaced your breast. Gently separate her from your breast and try again. If your baby's development continues normally, feed only with breast milk between the first 4 and 6 months after birth. Due to the colostrum for the first 2 to 3 days, your milk comes in a small amount, but will continue increasingly later. Step by step the right ways to keep your baby while breastfeeding. While breastfeeding, make sure your baby's whole body is in the same plane and facing you. Keep your baby's mouth close to your breast. Don't make too much effort to lie down. If you want, you can get support by putting a pillow beside yourself or your baby. All these make it easier for your baby to grasp your breast fully and correctly. Hug. It is a favorite of many mothers. Your baby sucks the breast on the side of your arm that you hug. Reverse hug, suitable for babies who are premature or have difficulty in grip. Grasp your baby with your arm on the side you are not breastfeeding and support your baby's head or your own breast with your other hand. Armpit. It is applied in twins, big-breasted mothers or sunken nipples. Stretch your baby into the armpit where the breast you will breastfeed is. Inpatient. Cesarean delivery allows mothers who are tired after a problematic or normal birth to rest while breastfeeding. Your baby's face and body should be facing you. What happens to the mother's body during breastfeeding? With pregnancy, the breasts become larger, the nipples become darker and larger. The number of milk glands and milk ducts increases. The trunk and legs provide the energy required during breastfeeding by storing fat. On the 3rd-4th days, milk secretion increases. As long as your baby sucks you, your breasts secrete enough milk.